is Lisa Stone. I'm the Bariatrics Coordinator here at Stringfellow Memorial Hospital. This webinar will be discussing opioids. Drug overdose deaths continue to increase in the United States. From 1999 to 2017, more than 700,000 people have died from a drug overdose. Around 68% or more of those overdoses are related to opioids. In 2017, the number of overdose deaths involving opioids, including prescription opioids, was 6 times higher than in 1999. On average, 130 Americans die every day from an opioid overdose. What are opioids? Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available by prescription such as oxycodone, hydrocodone, codeine, morphine, and others. Prescription opioids used for pain relief are generally safe when taken for a short time and is prescribed by a doctor, but they can be misused. Misuse of opioids includes taking medication in a way or dose other than prescribed, taking someone else's prescription medication, or taking medication for the effect it causes to get high. This is the story of Mike. Mike grew up in a typical blue-collar family, playing street hockey and pickup football in local parks. He was always a good student and excelled at 3 sport varsity athletes in high school. During his senior year in high school, Mike had surgery to repair a broken wrist due to a hockey injury. Following his surgery, he was prescribed an opioid pain medication. Shortly after this, his wisdom teeth were removed and he was written another prescription for opioids. Mike believes his use of prescription opioids transitioned to an addiction within 3 to 6 months after taking the first prescription. Short-term use of opioids can make people feel happy and relaxed. However, opioids can have harmful effects, including drowsiness, confusion, nausea, constipation, euphoria, and slow breathing. Opioid misuse can cause slow breathing, which can cause hypoxia, a condition that results when too little oxygen reaches the brain. Remember after your surgery to follow the warning labels on your prescriptions for your medication because it does make people drowsiness and confused and have some nausea. Please make sure that you're taking your pain medicines with food, and do not drive while you are under the influence of these medications. Long-term use of prescription opioids, even as prescribed by a doctor, can cause some people to develop a tolerance, which means that they need higher or more frequent doses of the drug to get the desired effects. Drug dependence occurs when repeated use causing the neurons to adapt so that they only function normally in the presence of the drug. Some chronic pain patients are dependent on opioids and require medical support to stop taking the drug. Drug addiction is a chronic disease characterized by compulsive or uncontrolled drug seeking and use despite harmful consequences and long-lasting changes to the brain. Long-term opioid use is not usually seen in bariatric patients, so please make sure that you get in contact with your provider if you're having increased pain or if you are unable to stop taking the medications within like the first 30 days of surgery. If you are prescribed opioids for pain, never take the opioids in greater amounts or more often than is prescribed. Follow up with your healthcare provider for any concerns that you may have. Never sell or share your opioids. Never use another person's prescriptions, and always store your medications out of the reach of others, including visitors, children, friends, and family. Safely dispose of any unused prescription opioids. Your communities will have a drug take-back program, or your pharmacy may be able to take them back, or you can flush them down the toilet. You will also see on the screen resources for drug overdose, and misuse of opioids. Please be sure and take advantage of this if you need to, or if you even know somebody who might. Points to remember: people misuse prescription opioids by taking medicines in a way other than prescribed. People who use prescription opioids can feel relaxed and happy, but also experience drowsiness, confusion, nausea, constipation, and slow breathing. A person can overdose on prescription opioids. Naloxone is a medication that can treat an opioid overdose, when it is given the right way. Many times when you're given opioid prescriptions, your pharmacist will also give you a small dose of naloxone to take just in case you have or a overdose with the opioid use. If you have any other questions or concerns regarding opioids or any other bariatric subject matters, you can contact myself, Lisa Stone, at the number on the screen, or Aniston General Surgery, Dr. Black's group, at the number also on the screen. Please let us know if you have any questions or concerns on this topic or any other bariatric subject matters. Thank you.